Following my last video about common cat illnesses, I, Coffee Cat, would like to share with you about cat urinary issues. Urinary issues in cats are very common and can manifest in various ways, and this is why it's so important to know as much as you can. Let's look at the symptoms first. The most frequent symptoms include frequent urination, often in small amounts, straining to urinate, blood in urine, urinating outside the litter box, crying out in pain while urinating, excessive licking of the genital area. These symptoms can indicate several conditions, collectively known as feline lower urinary tract disease, FLUT. Common causes of FLUT include 1. Urinary tract infections, UTIs. 2. Urinary stones, uroliths. 3. Urethral obstruction. 4. Feline idiopathic cystitis. What are the main differences between a UTI and FLUT in cats? The main differences between a urinary tract infection, UTI, and feline lower urinary tract disease, FLUT, in cats are made up of these things. Cause? UTI is specifically caused by bacterial infection in the urinary tract. FLUT is an umbrella term for various urinary issues, which may include UTIs but also other conditions like bladder stones, urethral obstruction, and idiopathic cystitis. How common are they? UTIs are relatively uncommon in cats, especially in younger cats. FLUT is more common, particularly in middle-aged, overweight cats with limited exercise. Age of affected cats. UTIs are more common in older cats, 10+ years, often secondary to other health issues like diabetes or kidney disease. FLUT can occur at any age but is most often seen in young to middle-aged adult cats. Diagnosis. UTIs are diagnosed through urine culture to identify the specific bacteria. FLUT diagnosis often requires more extensive testing, including urinalysis, X-rays, ultrasound, and potentially blood work. Treatment? UTIs are typically treated with antibiotics. FLUT treatment varies based on the underlying cause and may include dietary changes, environmental modifications, medications, or surgery. Underlying factors. UTIs are often linked to conditions that alter urine composition or bladder function. FLUT can be influenced by stress, diet, obesity, and lack of exercise. In summary, while a UTI is a specific condition, FLUT encompasses a broader range of urinary issues, including but not limited to UTIs. Male cats, particularly neutered males, are at higher risk for urethral obstruction due to their longer, narrower urethra. This condition is a medical emergency requiring immediate veterinary attention. Diagnosis typically involves a physical examination, urinalysis, and possibly additional tests like X-rays, ultrasound, or blood work. Treatment depends on the underlying cause but may include antibiotics for bacterial infections, special diets to dissolve certain types of stones, surgery for severe cases of urolithiasis or recurrent obstructions, pain medication and anti-inflammatory drugs, environmental enrichment and stress reduction for FIC. Prevention strategies include ensuring adequate water intake, maintaining a healthy weight, and reducing stress in the cat's environment. How can I prevent my cat from developing urinary tract issues? To prevent urinary tract issues in your cat, increase water intake by providing fresh water daily, using water fountains, adding wet food to their diet, or flavoring water with tuna juice or sodium-free chicken broth. Feed a high-quality diet, preferably including wet food. For cats with a history of urinary issues, consider prescription urinary diets recommended by your vet. Reduce environmental stress by providing safe spaces, enrichment activities, and plenty of human interaction. Consider cat trees, perches, toys, and food puzzles to keep your cat mentally stimulated. Maintain a clean litter box environment. Scoop daily and provide enough litter boxes, one more than the number of cats in your household. Encourage regular exercise and playtime to help maintain a healthy weight and reduce stress. Schedule regular veterinary checkups, including urinalysis and blood work, especially for cats over 8 years old. Be vigilant for early signs of urinary issues, such as frequent urination, straining, or urinating outside the litter box. By implementing these preventive measures, you can significantly reduce the risk of urinary tract problems in your cat. Are there specific cat litter types that help with urinary health? Yes, there are specific cat litter types that can help with urinary health. Silica gel litter. Some silica gel litters, like Pretty Litter, contain color-changing indicators that monitor your cat's urinary health. These litters change color based on the pH and other characteristics of your cat's urine, potentially alerting you to urinary tract issues early. Hypoallergenic, dust-free clay litter. Brands like Dr. Elsie's offer all-natural, hypoallergenic clay litters that are highly absorbent. This type of litter helps prevent the growth of harmful bacteria or fungi that could lead to urinary tract infections. Low dust options. Litters with minimal dust are generally better for cats with urinary issues, as dust can irritate the urinary tract. Look for litters specifically labeled as low dust or dust-free. Clumping litters. These allow for easier removal of urine, helping to keep the litter box cleaner and reducing the risk of bacterial growth that could lead to urinary tract infections. Unscented litters. Some cats may be sensitive to fragrances, which can potentially irritate their urinary tract. Opting for unscented litters can be beneficial for cats prone to urinary issues. When choosing a litter for a cat with urinary health concerns, it's important to prioritize options that are highly absorbent, low in dust, and easy to keep clean. Always consult with your veterinarian for specific recommendations based on your cat's individual health needs. Can certain cat litters actually cause urinary issues? Yes, certain cat litters can potentially contribute to urinary issues in cats. Some cat litters made from organic materials like corn, wheat, soy, grass, walnut shell, tofu, paper, or wood can be problematic. These litters are often not very effective at absorbing moisture from urine, which can lead to issues. If the litter doesn't absorb urine well, it can allow fungus or bacteria to grow in the moist environment. Cats that don't keep their bottom out of the litter when urinating or don't clean themselves well after using the box may come into contact with this bacteria or fungus. This contact can potentially lead to urinary tract infections or other urinary system issues. To help prevent urinary problems, it's recommended to use highly absorbent litters that inhibit bacterial growth. Silica gel litters, like Pretty Litter, are highly absorbent and can help prevent bacterial growth. All-natural, hypoallergenic, dust-free clay litters, such as Dr. Elsie's brand, are also good options as they absorb urine well and reduce the risk of harmful bacterial or fungal growth. When choosing litter for cats prone to urinary issues, prioritize options that are highly absorbent, low in dust, and easy to keep clean. Always consult with a veterinarian for specific recommendations based on your cat's individual health needs. I think we've covered a lot here and I hope it's been really helpful. Please, just remember the symptoms and keep an eye out for your cat's health. I'm putting a link up top about cat health checklists, so please click for more information. Thank you for all you do for us. Lots of love, Coffee Cat.